So today we're going to be reviewing another one of the infamous antidepressant commercials from the early 2000s. These were the commercials that seemed to convince patients and doctors in the US but all over the world that these conditions were due to a chemical imbalance to be corrected by medications. They've aged really poorly, but I thought it would be fun to check them out and just kind of dissect what's going on in the ads. So enjoy.
It's like I can't participate in life. I'm too busy worrying. I don't sleep at night. I'm thinking about my friends. I'm thinking about my family.
You know, your worst fears, the what ifs, and I can't control it, and I'm always worrying about everything.
So no, I don't tell people about my anxiety. Everyone thinks I'm overreacting.
It's like I never get a chance to relax. At work, I'm tense about stuff at home. At home, I'm tense about stuff at work.
If you're one of the millions of people who live with uncontrollable worry, anxiety, and several of these symptoms for 6 months or more, you could be suffering from generalized anxiety disorder, and a chemical imbalance could be to blame.
So that's like the whole sleight of hand. At the start of it, it seems like a really nice ad that's kind of empathizing with what is really uncomfortable symptoms. I mean, obviously, if you're dealing with the kind of anxiety these people are describing, that's uncomfortable and it's debilitating, and it's nice to have that acknowledged. But then they come in and they say, well, you might have a disorder that may be due to a chemical imbalance. And then it goes on to say, maybe you need Paxil. Let's keep on checking it out.
Paxil works to correct this imbalance to relieve anxiety.
There's no underlying chemical imbalance in anxiety that Paxil is correcting. They're trying to present it as almost like insulin for diabetes. It's correcting some well-defined underlying biological process. The truth is, with anxiety, it's due to everything. You can have an anxious temperament. You can have anxiety-producing factors in your life. To reduce the whole thing down to a chemical imbalance that Paxil corrects, it's totally misleading, and it's actually harmful, when you think about the side effects of the drug. We're going to check that out in a little bit.
Prescription Paxil is not for everyone. Tell your doctors what medicines you're taking. Side effects may include decreased appetite, dry mouth, sweating, nausea, constipation, sexual side effects, tremor, fatigue, or sleepiness. Don't stop taking Paxil before talking with your doctor.
Yeah. So they miss, what we now know to be the major side effects of this class of medications. Bipolar switches, suicidal thoughts, suicidal behavior sometimes, the fact that they're massively dependence producing, meaning that if you stop them, you go into severe withdrawal. The fact that withdrawal syndrome can cause protracted withdrawal injury and essentially neurological brain damage that can last for years. And that this medication can also cause PTSD. So they completely missed important risks of the drug back then when they were advertising it. Clearly,
people taking MAOIs or thiaridazine should not take Paxil. Paxil is non-habit forming.
And they say, Paxil, non-habit forming. It's this sort of sleight of hand where they try to say, don't think of this as an addictive drug. But many people would think about it with that term because a lot of people would associate the fact that once your brain gets used to this drug, you can't stop it without withdrawal as it being physiologically addictive in some way. Very misleading language to make the drug appear safer than it is.
Facing the day is easier. I feel like me again.
I think they aged terribly poorly, but that's where so much of the misleading information about these medications came from these massive media campaigns in the 2000s.